I clicked it.
Yeah.
Hi, everyone. Welcome
Hello.
to
Hello.
Friday Night, Sister Comadre.
Yeah.
So today we're excited. Well, tonight we're excited to have two special guests along with myself. Both doctors, Dr. Ivana Sturdivant, medical doctor from
Hello.
Tennessee, Dr. Tanya Chaldaris, educator and mom as well. So, ladies, thank you for joining us. Today, we're going to discuss mental health, and we're really going to discuss as women how we can take better care of ourselves, especially during this time, during COVID-19 crisis, Black Lives Matter and protest, and the fight for racial justice, particularly for women of color. And so, what we'll do tonight is just really have a conversation as sisters, women, to talk about, what's really happening in our communities.
Okay.
So, both Tanya and Ivana, would love for you to just start off telling us about yourself, your story of self, how you grew up, any, experience of trauma you've experienced, and how you've overcome, and what type of work you're doing now to really help women and families be their best.
Ivana, you could go first if you'd like.
Okay, sure. Well, my name is Ivana Thompson, and I am a OBGYN here based in Nashville, Tennessee. My story itself, I grew up in New Jersey, so I'm really from the Northeast, and grew up in a rural part of New Jersey, which people don't typically think exists, but it's there for sure.
Yeah.
And the area that I grew up in was pretty racially diverse, but I ended up switching schools when I was in middle school because my parents wanted me to go to a better school, so they paid for me to go to a better school in a white neighborhood that was not where we lived. And that was a good experience for me academically. I did well, and I was able to position myself to go to MIT, where I met Margot. But it also, I think, was probably one of my first experiences, like being acutely aware of Blackness and how Blackness makes me different from others. So went to college and did a lot of really great work with Margot with the organization on campus that's focused on supporting Black women students. And I think that's where I really found joy in being around women, especially Black women. And so thinking about how I could center my career on that, and ultimately landed up in medical school and becoming an OBGYN. And in my work as an OBGYN, I really work to center my patients, center their experiences, to help them have the health outcomes that they want, and to respect them and their story. So, and I find that doing my work, I get to help women, and that makes me excited to do work every day.
All right. Awesome. Thank you. Ivana was also a teacher too before.
I was a teacher too, yeah.
So she has that context of working with children as well.
Right. I'm Tanya Chaldaris. I'm a doctor of education in urban education, specifically in urban leadership. And I grew up in the LA area, Northeast LA, well, everywhere. Everywhere. My dad was a garment worker in downtown. So we lived in Hollywood, we lived in Atwater, we lived in Sunland. Very scary time. Tahunga, also very scary for me as a child during the LA busing protests. And I was sharing earlier before we started, it was really a physically and emotionally brutal time for me as a child. These protests bleed into schools. I'll leave it at that. So in my life growing up, it painted everything about my life. And so their racism across the whole path of my education, their racism became my shame. And so there was especially by the time I hit 5th grade, I stopped speaking Spanish. Even at home, I stopped, wanting to be connected to all those hateful things. And I won't get into the rest of the full description of what that was, but suffice to say, it was very scary. I went on and ended up, we were homeless for a period of time. We lived in motels. I dropped out of high school. And out of the love of my mother, who started school at the same time I did to better herself, she became a school counselor and MFT, so marriage family therapist, and became a professor at the university I got my master's from. And full circle, she was able to hood me for my master's degree, which was just a beautiful moment. And then I went on for my doctorate. And she and I have worked together just about at every single school I've ever worked at. Her as a therapist and me as an educator or administrator. And and so now we're here and unanimously authorized for a community school called Calliope Academy that unfortunately due to pandemic we're delaying 1 year opening till next year, but it will be opening and focused in the Cypress Park area of Northeast LA, kind of going back home.
Thank you.
Thank you.
Thank you for sharing. So I want to change courses a bit. Since it is Juneteenth, the celebration of the freedom of enslaved African people in America, really want to talk about trauma and how it can be passed down from generation to generation. So I have read several medical articles about how it actually, trauma, stress actually does physiologically change your body, and it can change how you function, lead to high blood pressure, diabetes, depression, and it's passed down in our communities, both in Black and Brown communities. So Ivana, would love for you to talk a little bit about, as you work with mothers who are pregnant, how these things can be passed down so we can better understand where this comes from.
Sure. Sorry, I'm just gathering my thoughts. Yeah. But whenever race and health disparities come up in discussions that I have with my medical colleagues, I always take a bit of pause because when we talk about race and the way race has impacts on health outcomes, it's not biologically driven. There's no biology behind race. It's a social construct. And the health equity, the health inequities that we see based on race are a product of how people are treated based on race. It's it's a behavior issue. It's not a biology issue. Because I feel when COVID is, but when we're starting to see these racial disparities in COVID, I think we were trying to run to things why is that? I'm well, it's because we treat brown and Black people different. We don't have the same access to healthcare. Our complaints aren't taken as seriously. That's why we're seeing these different outcomes. It's not because we're built differently. It's because we're treated differently. And I definitely see that in my pregnant patients. And oh gosh, I just want to go off on tangents.
Yeah, but just tell us. So you see your pregnant patient. So I know that, in low income communities, Black and Brown, babies are often born low birth weight, which affects them long term. And a lot of that comes from the mother, the mother living in tough conditions. So talk a little bit more about that.
Sure. Yes, Black and Brown women have a higher rate of preterm delivery. Preterm delivery comes low birth weight infants. And that comes with a bunch of medical sequelae that can play out over a lifetime. And it's interesting because you can take someone who was born on the continent of Africa, where they do not have that same elevated risk of preterm birth and delivery, and bring them to the United States, and that risk goes up.
Yeah,
wow. That just shows me how this is very much so a product of how our patients are being treated. And the way the ways in which we see this, well, I think these impacts are on many levels. There's personal impacts of racism. There's systemic impacts of racism when you're told that you can't bring your children to the office with you, when you can't be more than 15 minutes late to your appointment or you won't be seen, or maybe your doctor's appointment isn't near a bus station or other public transport where you can't access the care that you need. Like there's so many layers to that, and all those things build up.
Yeah,
and we see them in our birth outcomes.
Yeah.
You know, it's so interesting, this birth outcomes issue of like, you know, how Black women and Latina women who are U.S. born, and I think that's the big difference, is the U.S. born women are the ones who have the higher rates of preterm birth. My daughter, Miketsi, who's going to be 21 next week, I can't even believe it. So she's going to be a full-on adult. She was born when I was 25 weeks pregnant, and I wasn't quite, I was, you know, very, very early. Most pregnancies, as most people know, go to 40 weeks. So I was 15 weeks early. And she was considered at the cusp of not being what they call a viable pregnancy, that she might have died. In fact, the doctor told me not to get attached, that she would survive after she was born.
Wow.
And she weighed 1.5 pounds when she was born. And I was looking around the hospital, and we were in a pretty diverse community. But the only kids who were in the preterm labor, with the NICU, the neonatal intensive care unit, were all Black and Latino kids. And that was a moment. I was a fairly young mom, you know, and so looking around, I thought, God, why is it that it's only Latino and Black kids here? That that was such a deep moment for me, where I realized, wow, like our kids are very much at risk, even from before they're born, you know?
Exactly. And Alma and I have been talking about this for a long time, but just the lack of medical professionals that represent Black and brown people in our communities is stark. Particularly in California, the shortage of Latinx medical professionals and doctors is alarming. There was a report, right? We read, Alma. It said it would take 500 years for us to get to a point where we have enough Latinx doctors that meet the population requirements per capita.
500 years.
500 years, y'all.
Wow.
And we live in California. So not only that, we don't have people operating that understand deeply what's happening in our communities. And so that's a huge issue we always talking about and are trying to work on for people. So Tanya, what do you?
I have 2 points. One in particular is something that Ivana brought up in regards to the treatment of women of color when they're seeking care for their children. My child, I believe in vaccinations. My child went through vaccine at 2 months. This is for whooping cough, the Tdap, DTaP, quite different things. But went through the 2 month and the 4 month. The next cycle was 6 months. And between 4 and 6 months, this is before we knew that whooping cough had kind of an end date for of about 10 years or so for efficacy. And my daughter was exposed to whooping cough. I went to the doctor. I asked the doctor, it's the Beverly Hills doctor. I had insurance because I had a great insurance, and I made sure that I took her to the best in town. And unfortunately, he didn't believe me. He says, we've eradicated that. You don't know what you're talking about. And I said, well, I've worked in a health, like as a teacher, and we've learned a lot. And I can tell you that her skin is getting red freckles. It's called petechiae. Her eyes, the whites of her eyes were getting petechiae. I was doing rescue breathing and, doing all the training that I learned as an educator to keep my child breathing. There's something wrong. No. He kicked me out of his office. He said she was fine. And then I, of course, and this is my recommendation to mothers, be persistent.
Yeah.
Do not be apologetic.
Yep.
And if you're not going to get your answer from someone, go somewhere else. That's when we discovered it's a nasal swab, like we're dealing with right now with COVID. A nasal swab, and we discovered she was actively with whooping cough. So the whole house had to be treated. And the whole daycare, because I had started work again, the whole daycare had to be treated. And then letters had to go out through the health department, like the contact tracing that they're doing now. And the following year, so this was in November, the following year was the first California outbreak of whooping cough because people are not vaccinating their kids. But this is predominantly affecting people of color when you're not able to get the medical care that you need. Side conversation regarding care and medical care for your children, something that we notice in schools. A child who has to go to a clinic, which we're so grateful that we have clinics, but a child that has to go to a clinic has to give up their time to a more emergent cases that come in. And so their appointment is pushed and pushed and pushed and pushed and pushed. And there are times where parents who bring in their child for well baby visits or vaccinations or any kind of care don't end up seeing a doctor after sitting in a clinic for hours and hours and hours. And that's lost learning time. Which is one of the reasons why we're looking at creating these mobile clinics that come into the schools. So that there's no competition for emergent cases. Specifically for that, the child gets called out, the parent is there, child gets the vaccinations or gets to visit with the doctor and goes back to school without the loss of time. So there's this progressive loss of learning. And statistically, they said about 10 times a year, kids will get sick between the time they start school until they're about 10 years old. So that's a lot of learning time. It's extensive. Hi.
Hi, Cynthia.
Remember?
Cynthia's joining us from New York.
Awesome.
Yes. We're so excited that she's able to join us. Oh, hold on. Okay. Yes, we can hear you, Cynthia.
All right.
Can you hear me?
Yes. Yes.
I can't hear you.
Oh.
I can't hear you.
Okay. Let's see. She's having a hard time hearing us. Okay, hold on just a minute. Okay. Hopefully she can adjust her
sound,
her phone or her thing setting. Yes.
Okay.
Okay, let's see.
I wonder why.
Okay. So hopefully she'll be able to hear us.
Can you hear me now?
Yes.
Yes.
Oh, good. Awesome. Okay. I'm sorry about that.
No, that's okay. Cynthia's a mommy and has mommy duties at this time in New York since 7:18 in Southern California, but 10:18 in New York City. She's on your time, Ivana.
It's 9:18.
Oh, okay. You're 9:18. Okay. Central time. So we've got Pacific, Central, and Eastern time today. So this is so beautiful. And so Cynthia is one of my lifelong friends. She's actually brilliant, not just because she's my homie for life, but she's also an expert on all things related to childhood development, psychological development, social development, and was actually the person who introduced me to something called ACEs, which she'll talk about, but this strategy of understanding trauma. Childhood trauma and how childhood trauma impacts us as humans, and how as adults we can help support children, but also what she and I have been talking about as Sister Comadres is really how we can understand ourselves so that we break that cycle. and it doesn't impact the next generation. And so so I'm so glad that Cynthia was able to join us, because so much of what we've been talking about, those traumas, very much start as children, and how can we as women and mommies or tias and aunties like change that, right?
Yeah. I was going to add, and this is perfect that you're here because I don't have to then explain it, is the tie-in. So it'll go perfect with you, Cynthia, is this idea of what we do call ACEs, right? The adverse childhood events. And in education, statistically speaking, and this comes from Dr. Russell Rumberger, like the expert in dropout prevention and dropouts nationally, he noticed that kids who suffer an adverse childhood event in about the first grade, and that could be a divorce, it could be the loss of a parent or anyone, just a loss or a significant event, will actually be more predisposed to become high school dropouts. And in that in itself also puts them later on in life and this goes with what Ivana was talking about, at a 10-year shorter lifespan. And so it's important, there's an arc and it's all connected. And so how are we, and I'll leave that to you, Cynthia, how are we addressing these adverse childhood events that we don't really have control over, but we're in one right now with the entirety of the population of the world mid-pandemic. Children are living through something right now.
Yeah. So first I want to say thank you for having me on and allowing me the opportunity to have a voice, especially during this very special day today, when many people don't have a voice. So I want to appreciate that. So I currently oversee a mental health clinic here in New York City, and we provide services for families that have been exposed to trauma, and specifically for children 0 to 5. So ACEs is very big in our work, and we're in the healthcare environment. So we are always looking for identifying trauma early and treating it so that we can break that intergenerational transmission of trauma. ACEs, the study has been around for a very long time. I think people are really trying to figure out how to use that science to make a change, I think, for children so that they aren't succumbing to the 10 years of shorter life expectancy and all of the other detrimental like health outcomes that are associated with trauma. What I have found though is that, and I'll speak just for here in New York City, is that the sectors aren't talking to each other, right? So you are in education and we are now having conversations with schools about how to be trauma informed in the school, but it takes so much more than just having this lens that we talk about and to understanding trauma and treating trauma. I think it's time for us to now work together and treat people holistically. I think that's what's been missing, right? And I don't think that it would be fair to talk about this without talking about the systemic racism that we're seeing in the educational system as well. It's all sort of tied in, and we really need to start thinking about how we integrate mental health services at a very young age, because I believe that it's not even identified for most children until they're in the 4th grade, right? The early trauma, which by then you're already labeled, you're already on a trajectory, you're already, your teachers perhaps are treating you based on what the label is that you've been given by a doctor, and there's no communication between the pediatrician and the school, and so it isn't a very holistic approach. What we're trying to do here is really bring the sectors together, bring the different systems together, and really, and we're trying to get into the early childhood centers to do a lot of this work so that we're treating the children early and we're talking to the parents about what it means to get the trauma treatment at a young age. I think that many people in the field are familiar with ACEs, but our general population and the community members aren't, especially communities of color. And so I think a big push for us is getting education out to the community, and also doing cross-sector collaboration with early childhood centers, WIC centers, different centers around, educating them around ACEs, and also getting parents the resources and the information that they need. We all know that parents want the best thing for their children. They just don't know how to do that. And so we want to be able to bridge that divide.
Cynthia, I have a question for you ladies. Can you tell us, I know you guys are experts in your field. What is trauma? What are things that are trauma? How do you classify trauma? Somebody mentioned a divorce, but for me, how would I know that this is something traumatic? Or how would I know that this is something I should look for and be able to say, oh God, that's traumatic for my child, or that was maybe a trauma that I experienced as a child?
I can say what we've been trained in schools. We had to bring somebody in specifically for post-traumatic stress disorder when we started to receive a large number of students that were from war-torn communities around the world. But what we discovered, there's not much difference between those students and children who are growing up in really violent domestic, communities that have a higher proportion of domestic violence and all of that. The behaviors are very interesting. PTSD in children, especially younger children, will manifest itself as hyperactive behavior. And so sometimes we tend to identify students as ADHD when they might actually be dealing with another trauma. So it's the thing that we'll notice. There's also the child will, may withdraw completely, stop finding interest in the things that they love. And as a teacher, we're trained to monitor that, but we're not all trained in the same way. There's a push in schools, in particular in LA, we're pushing really hard to definitely be trauma informed, not just informed, but trauma proactive. But Cynthia can speak, I think, to that, or Ivana.
I'm gonna defer to you and to Cynthia. It's not my area of training. I can speak as me, a Black woman, a mother. I don't have the medical definition of it. So my approach is more I know it when I see it, but I can't give you the words.
Spidey senses.
Yeah.
Yeah, and I don't have the formal DSM diagnoses here. I can say that it's definitely the result of something that's happened to you, or that you've experienced, or that you witnessed, where you have felt helpless, where you have been unable to feel like you didn't have control of the situation. So there's a sense of loss of control, feeling helpless, and it's impacting your functioning. You can talk about PTSD, I guess, as a diagnosis. But we also like to think about the little T's. So all the little traumas that are not necessarily big traumas, right? So not the sexual abuse that we see, not the domestic violence exposure, but what about the bullying, or what about the microaggressions and all of those things that our children are experiencing? So we tend to now sort of steer away from the diagnosis, because we feel like we shouldn't wait until we're there. But really, if children are exhibiting symptoms like aggressivity, or if they are being labeled as ADHD, which many of the medical providers will diagnose them because they're hyperactive and they're unable to regulate their bodies, especially when they're very young. We're looking for anything that is happening. So the small T's will eventually add up and have the same impact, I think, as one big event that can occur.
That's a good point, Cynthia. Sort of like there are micro traumas, like microaggressions in the workplace, but micro traumas both at home and in school. And so building off that, I'm just wondering, my mom always says, if a child is experiencing something tough, talk to the parents and see what's happening with the parents, what's happening behind that wall at home. And a lot of times our parents have experienced trauma. And so it's just a cycle over and over. They have micro traumas, especially women, micro traumas on a daily basis. So in your work, Cynthia, do you also work with parents or like some sort of way to bring families together to
Yeah.
traumas?
Yeah. So in the 0 to 5 world, you can't work with the child without the parent because the child the trauma. The trauma typically happens in relationship with the parent, and it's either that or it's the mom has their own trauma, like you said, and now the child is being impacted by mom's trauma symptoms. So either way, the child can't work through the trauma unless mom is present. So the difficulty in our work and what we're finding more and more and kind of coming to a realization is that with the little ones, you do this child parent psychotherapy, which is our main mode of treatment at our clinic, where you're doing the work with the mom and the child together. So it's like you're seeing the little one individually with play and doing whatever is appropriate for that age. And you're treating the mom individually and you're treating the relationship. So it's like you have 3 clients in the room with you. It's very complex and it's very challenging, I think, for families, especially in communities of color. What I've noticed is a difference with the 0 to 5 population is that you have to bring in the trauma history of the mom. You have to address the mom's trauma history. And as you know, and you mentioned, many of our moms have a lengthy trauma history. With pediatric psychiatry or general behavioral health, which tends to start at 6 and up, our parents are now going to take their child and you get to sit in the waiting area and not have to address your trauma, right? You're like, my child is exhibiting the symptoms, please take care of him. And I'll be in the waiting room here waiting for my child, right? And so there isn't a deep dive into the mom's history. Mom doesn't have to work on her own trauma, right? You're sort of just giving your child to the therapist in hopes that they'll work on resolving the issue. So what we're finding is that the child parent psychotherapy is very challenging for communities of color because there's so much trauma there, and if you're not ready to address it, you're not going to show, right? So you're not going to show up with your little one, and unfortunately your little one is the one that's going to have difficulties down the line. So the work is always with the parent and the child together, as well as the parent individually if needed. Yeah.
Can I ask you, Cynthia, just it's a thought that I had while you were speaking in regards to the therapists. I wonder about that here too. Is there an effort to understand the nuances of people of color and the traumas that they go through? Sometimes I feel like someone who hasn't done the work, it doesn't mean that a person of color can be the only person who's providing care. I just mean if that person themselves hasn't done the work to understand the culture that they're serving, is there work or an effort done in that capacity in the training? Or, I mean, I know we have to do it as educators for certain. So it's like a component of professional development for us, but I'm just wondering for you guys.
Yeah. So for us in particular in our clinic, you hit it right on the head. Most of our early childhood mental health clinicians are psychologists, right? We know that about 80% of psychologists are white. We've been talking about culture a great deal, and it's difficult to teach somebody about culture and the lived experiences of people of color. That's just a fact. What we've moved away from is the traditional psychotherapy because, and I'll speak for me personally, it's not serving our community like it should, and it's not training that they're receiving in their PhD training or PsyD training, because it's a framework that wasn't developed for us. It's a framework that's based on a Western colonized model, which does not apply to people of color. And so, not only is there a stigma around mental health, but when we show up, we're not understood. It's a very individualistic approach. We are a very we're people who thrive off relationships and thrive off of family and thrive off of many things that are not part of the westernized Western culture. And so I personally think that that's one of the reasons that people of color are not showing up and not engaging in treatment. I know you can talk about the DSM-4 and the DSM-5 and who created it, right? And it's not based on people of color. Evidence-based practices are not based on people of color. I'm now on a mission to decolonize the framework that existed in mental health, so that we cannot have a lens that you can take on and off, because I refuse to use the word lens when it comes to diversity and culture, because it's not a lens. It should be embedded in every framework when it comes to mental health. It's the only way that you are going to treat people and treat individuals in a way that's going to be truly healing for them and understand them. And so you're right. Time and time again, I find myself thinking that you can't train, you just can't train people on culture. There's no culture sensitivity. There's no cultural responsiveness. We need more practitioners that are of color. We need, if not, then we need to change the framework, and we need to be teaching this in our schools.
Yeah.
It really does. It goes across the entire spectrum. It really does. I think we're hamstrung in essence by our inability to be in the space to the extent that we should be. Right, our voices. This opportunity right now, us talking, has left my brain firing, and I'm going to end up reflecting for hours after this is over. But I'm just aware at how many failings we have in our system. It's a complete breakdown as an entire society when it comes to approaching people of color. We've been designed for one population.
This is a huge reason why Margot and I have been friends for a while, and we've been talking about how do we bring Latinas and Black women together to talk about issues that we know we have in common. I think too often, we talk about like, oh, this is an issue for the Black community. Oh, this is an issue for Latinos. And there's not necessarily a conversation of like, where are the similarities where our communities are facing the same challenges. And of course, there's things that are very unique to the Black experience. And of course, there's things that are unique to the Latino experience. But there's a lot of stuff that we have in common. And this issue of not having access to the right mental health providers or the right mental health support is a big one. I've shared, pretty publicly with both with my friends and also on other platforms that I've had a history of depression, and it's a hard topic to talk about, because in Spanish there's not really like a term that we often use for depression, right? And when I was very, very sick, which was about 11 years ago, it was hard to talk to my family about it, because my family didn't have the awareness about it. And the first time that I had my first major incident was after my mom died. And Cynthia, was still is one of my best friends. And she experienced that traumatic experience with me when I was 21. And then, fast forward another traumatic experience 5 years later, and then another one, right? So like there's these like episodic experiences with mental health that I needed support with. And the first time I didn't really get the support, but I didn't even know the words to look for help, right? I didn't know where to look. And I'm so grateful that I was able to find an amazing Latino therapist who helped me, right? And I always sing praises about Carlos Ramos. And Google him because he's fabulous and he's here in Pasadena. But I love Carlos because he helped get me out of the space that I was in, and he helped me get the medical care I needed, which allowed me to get back on track. But for years, people never could imagine that I had, suffered from that illness. And I had to, articulate, depression is actually an illness. And there's all the stigma around not taking the medication. I was afraid to take the medication because I didn't want to get addicted. I had all these concerns about it, but luckily, as soon as I got both the medicine that I needed and also the therapy that I needed, I was able to get healthier. And that's one of the reasons why I talk about mental health so openly, because there's not enough of us saying it's okay. This is an illness. And I'll never forget that my doctor said to me, she said, if I told you had diabetes, would you take the medication? And I was like, of course. And she was like, I'm telling you, it's another D diagnosis. It's depression. We take the medicine. And then it was like, oh, of course I'm going to take the medicine. And, it helped me. But being exposed, that's why I want us to have these conversations. Yeah. We're struggling with, anxiety because we've been cooped up, 3 months, right? And we've been maybe cooped up with people we don't want to be cooped up with.
Exactly.
Girls,
just to add to Alma, so like, I think the biggest problem in our communities is people don't even know when they are depressed. Like, they don't know that what they're experiencing is actually abnormal. Yes, you may have lost your job, this or that, but the way you're feeling, you can't get up, go to work, you can't think. That is something that is a diagnosable problem that can be treated. And so I think the big thing is that people are unaware that what's happening to them can actually be treated, and it is a problem. And particularly with kids, it's so interesting. So Tanya and Alma know that I work in the community with kids, South LA. And every time we do an event and pitch, the kids focus on creating tech to help some sort of like traumatic problem in their community. I worked with one group at the Girls Club of LA. 8 kids wanted to work on drug addiction. Kids. And they wanted to build something to help build empathy for drug addicts. They said crackheads in their community because they've had empathy for these people. And I think what's happening in our communities, people are treating their problems with drugs and alcohol and gambling and whatever else there is out there. Domestic violence against women. A lot of men are taking their aggression out against women and fighting for children. And so the violence is there, and that's mental health manifesting itself in a tragic way. And the kids are aware, but people don't they don't have the language to say, oh, well, maybe I'm bipolar, or maybe this guy has schizophrenia. This is why my cousin did this. Or they are even learning disabilities. Maybe they're autistic and have never been treated. So it's sort of like there's a lot of things happening. People don't understand. They think it's their fault. Or they don't have
one to get over.
They don't know where to go to.
From a healthcare perspective, like, we have tools that are built that we use to screen people for depression, and we, like, when we meet people, just like over their history and stuff. I feel that our encounters with patients are so strained and constrained with our our schedule. So I know, oh my gosh. So stepping back from being the healthcare provider, like accessing healthcare and going to the doctor's office and checking in on time, and then like waiting the half hour. Yeah. The reason why we're waiting the half hour is because we're trying to talk to all the like other patients that are like scheduled for the same time slot. And that puts a real strain on us. And we rely on these tools, but I also think a big part of medicine, and I don't know that it's being taught effectively, is like, you need to be able to pick up the vibe, like in a room. Like, if you
Spidey senses, I say that all the time. Yeah.
Like, if you're in a room with someone and you're talking about some basic health stuff and they start crying, like, you need to pick up on that. And you need to be able, and you don't necessarily have to interrogate them. Because I remember learning in med school that, like, I think the average time from patient starts talking someone asking you questions like 30 seconds or something. You don't need to like jump on folks like that. But I think as healthcare professionals, we have to be able to like pick up on what's happening, what's being said, what's not being said, and follow up and lead into these things. And seeing like, well, I hear what you're saying. Like, I hear what you're saying. It looks to me like you're upset. Can you tell me what you're feeling? Like, what are these tears for?
Yeah. As educators,
and conversation that will really, I think, get to some of these underlying issues and really help people to open up to build that relationship with you, so we can like take care of some like real issues.
I have two things to say. One is regards to what you're saying, Ivana. It's when you have this kind of list of questions, whether it's screening in 0 to 5 for autism, right? Or you're screening for depression. I actually, because I do sit on a nonprofit medical board, and so I sit as an educator. That's my role. I'm not a doctor. I'm not a doctor. I'm a doctor, but I'm not a doctor. And it goes to also what Cynthia was saying. We're really struggling with this cross communication. Can you imagine if you as a doctor or you as a therapist could get information from the teacher or from the school saying, I've noticed this child's lost a certain, grades have dropped, or the child's falling asleep in class, or if you could find out that the child has been going to the nurse's office 15 times a day or 15 times a week. If we would be able to have lower the silos is what I call it, reduce the number of things, the barriers that get in the way of us communicating holistically about the patients that we typically all serve, but we're not able to talk to each other. How do we create a space where we can do that? And unless the parent is savvy at this moment in time, and the parent is the one that's advocating and taking the information from the school to the doctor to the therapist, everybody is operating a little blind.
And right now, the biggest problem we have with COVID-19 quarantine, reports of domestic violence is at a lower than it usually is. And we're all worried because people are at home with people that could be the abuser. Children may be at home with their abuser. They're not in school. Who do they report it to? For women, if you're quarantined at home, like, how do you get to the phone and report this?
We have
be dealt with.
In this time, as an educator, Margot is aware because she was living it at the same time. Well, I was sharing with her as I was living through it. I required my students as we went off to at least send me a video blog, right? Just like something simple. How are you feeling? And I'll send little surveys. How are you feeling today? Or send me a video, but it's videos. And it goes back to what Ivana was saying. You see the look, the affect. I have this student, the affect changed tremendously. And I went, something is up. And then the messages that were coming through were inconsistent and off. So we started digging. And then we offered counseling, but it's through telehealth. And the mom was sitting right there. And mom was talking. Mom was struggling herself. It wasn't that mom was an issue. Mom was struggling herself. And so the therapist was very savvy as well and was able to say later on, called mom and said, Mom, I'm noticing that when we were having the conversation with your child, that you were participating in a conversation. Would you like me to call you and check in on you every couple of days? Yes. Well, we discovered the child ended up homeless, needed housing, needed medical care, needed clothing. And, there was a whole crisis emerging as a result of COVID that we wouldn't have known, right? This situation is really ugly as it is. But if we're not operating with, it was me on the phone with the police department, with Department of Children and Family Services, the psychologist. We were all until 10 o'clock at night talking to each other, trying to find the family and help the family have a place to live. we're in an ugly situation right now, and you know, I'm glad I keep going like this. We're together and we're talking because it's a bigger issue, right? It's not unique to my school and my students.
Yeah.
You know, for me, one of the things that we're part of a network that's called One Family LA, and they're now transitioning, but two very dear friends and leaders initiated the program to raise money to help families meet their immediate needs. Mm-hmm. And, you know, I kept thinking about me. I'm a single mom, but I was thinking, even though I'm a single mom, I can figure things out, because if things really got bad, I have people I can turn to, right? Mm-hmm. But what about those moms, those single moms,
right,
who have no one to and nowhere to ask for help, you know, and broke, and may not even have $10 to go buy spaghetti.
True.
You know? I mean, like, and it's been a very scary time, and I was thinking about, like, how do we, you know, use this platform to help ourselves and be able to bring resources to say, these are the types of things that you should be looking for at home. This is the kind of stuff that you could do for yourself. The kind of stuff that you could do for your child or your children. Because, you know, my mom used to tell me this all the time. She would say to me, Mija, you didn't come with instructions. I can't go and say, what can I look for? You know, the truth is too, me Getsley, she sure didn't come with instructions. Nope. I'm winging it as a mommy. And I know most of us are doing that in our families. But this idea of, like, how do we help ourselves?
How do we help ourselves
in this traumatic time, man? Because this is trauma. You know, like,
it's trauma.
It's a worldwide trauma we're all experiencing. But being able to, I think, be in community and also know that as a network, La Comadre Network wants to be of help. And now this is why we expanded to grow from just being La Comadre, focusing on Latina women, to being Sister Comadre, to help Black and Brown women, especially during this time.
I know. Cynthia, I'm curious, what are some ways that you've seen have been helpful for treating trauma or helping women, and especially during the COVID quarantine, if there are any insightful things you've seen about how we can help people
in treating like parents as they're going through this. So we have been doing, we've been doing virtual sessions with them. Our mental health providers have continued to treat patients, but it's all about basic necessities right now. We even get to the real work. I mean, and right now we're trying to get them food. We're trying to get them diapers. We're trying to give them respite because they're having a hard time when their children need to go outside and they can't go outside. So just the little things, like having a session with a little one for 20 minutes so that mom can get a break to breathe. It's all those little things. There's no real room for any treatment, just really keeping mom sane on a day-to-day. That's where we're at, keeping her motivated. We're sending affirmations via text. We're having them do virtual groups, meditation groups, breathing groups, you know, all of that. So whatever we can do to help. But it's just keeping them grounded, I think, right now, and making sure that their basic needs are met. And we have an attorney on site, so he's available virtually for anything that comes up related to housing or, you know, anything. So that's been helpful. And I think that those basic resources are really what are helping parents right now. You know, and also like internet, laptops, just all of the things that we take for granted are now surfacing, and you're now seeing all of these issues sort of pile up, and moms, parents are unable to cope with it.
In regards to what you're saying with schools in particular, and the urge to get back to opening schools and getting, you know, we're realizing the economy can't function until the schools open. But we're not in a position to open schools because we don't have we just are not set up, operationally speaking, to create a safe space in the middle of a pandemic, to have, safe spaces for students and staff to be able to learn. And it's just such an obvious failing in our social system, right? If we had care for, this is where the activism, I think, kind of comes into play.
Mhm.
If we had mental health services for all, if we had affordable housing, if we had food banks, even if that's the case, if we can't manage to do livable wages, if we, there's so many factors that we could do as a society, but we're spending our money on things that tend to focus more on compliance and containing a society that's suffering, or a population that's suffering, people of color that are suffering, and being poor, and growing up one of the people who was in motels, and a kid who, was on, I was out there. I kind of know what that looked like. And even just a small extent, I wouldn't compare it to what some of my other students have gone through in their lives. But we as a system have absolutely failed to protect and shelter our entire population, right? We protect some, but we don't protect all. And we don't have a structure in place.
Yeah.
Something that it's what my dissertation was on, and I looked at, and you'll appreciate, Cynthia, Yuri Bronfenbrenner, this concept of the concentric circles, with the home, the child in the home, or the self in the home being at the center, and then the school and the churches, the greater political context kind of layered on the outside. But schools serve as a fulcrum, right, between can reach into the home, because we have compulsory education, and we have the ability to reach into the communities, because we have the agency to be able to manage that, right? But we're not doing a good job of communicating and reaching out and connecting the kids with the resources, and families with the resources they need.
Mm-hmm.
But my own thinking is, I'm always a what next kind of mindset.
Yeah.
What next?
Yes.
We as Sistah, Comadres, right? That we can get together and work to create that network, maybe within each one of us, where we in ourselves are a hub for the greater community around us, or the people that we work with. But how do we create something that's even more
broader?
Prolific?
Yeah. It seems like what's next is getting back to the basics for people and helping them connect.
In school, we have a saying: you can't bloom without Maslow, right? You have to have the basic needs before you can ask a child to start growing and learning and doing well in school.
Mm-hmm.
So.
I wonder if you have very specific advice in this idea of, like, we can check in on people, like, what advice, with all of your training and all of you are experts, right? Medical, doctor, advice. And obviously I know that you all have your own perceptions, but also you're experts. So what advice would you have for us individually?
Mm-hmm.
Like, how can we take care of ourselves? Mm-hmm. And then what can we do for another woman out there who maybe think might be going through some stuff?
Yeah.
And like, what's something concretely that we can do to maybe check on one of our comadres, to check on one of our sisters, to see, hey, are you okay? Mm-hmm. What are some advice?
I'm hosting Zoom sessions. I'm reaching out. I gave my little chat to all of my students and their parents. So I'm still, school was over already, but we're still connected, and they're still messaging, and I'm doing lessons, we're hanging out. Literally just, what do you need? And I'll send messages if I haven't heard from a family. Mm-hmm. How are you doing? Do you need anything? Can I bring you anything? Mm-hmm. If I know somebody, it's just, I have to reach out. That's the only way that I know how.
Yeah.
Yep. That makes sense.
I would challenge, to take care of yourself, I would challenge someone to state and to buy into the fact that you are valued, and that because you have value and because you're important, like you deserve to spend time to cultivate yourself and to make sure that you're growing and thriving the best way we can in whatever situation we're in. Because I feel that I see a lot of my patients and I see my friends and my coworkers that as women we take on so much crap.
Yes.
We do so much stuff for other people, and it's valuable work and it's good work, but I mean none of it gets done if you're not taken care of.
Yeah.
So take that time, like hard stop, pause, like you are valuable and you are worth the effort. So spend some time and do something that's restorative for you, whether that's getting more than 5 hours of sleep at night, or if that's eating something that's fresh and it's healthy, or something that like nourishes you, or if that's turning on like IG Live and listening to like the DJ live set while you're doing the dishes or something. Do something that makes you feel good. Because I mean, by you feeling good, you're going to spread that good and you're going to do good in your other works. So I think like it starts with that acknowledgement that you're worth the time, you're worth the effort.
Yep.
I love that.
Yeah. For me, I'd have to I echo your point. We have to give each other permission to slow down. I think we have to give each other permission to breathe, to feel our bodies, to feel the tension. So much, I think, of what we experience is related to guilt and this internalized inferiority, right, that's been fed to us for our entire lives, that we're trying to outperform, always overperform. This idea of being proactive and productive and efficient, and it's killing us. Like I recognize that if I have 5 minutes, I try to do something to be efficient in those 5 minutes. And it's just this idea that we have to overachieve, right? We're overcompensating. That's right. I'm coming to these realizations of that. I've been overcompensating because of the messages that have been fed to me. And I need to give myself permission to be just human and be okay with where I am. And allow myself the space and not feel guilty about it is the other one. Guilt is very powerful, and we need to not feel guilty for giving ourselves the space and the time and the breath that we need every day.
You made me think of, it's something that I've shared with Margot, and I share with my entire board and everybody I work with. I always talk about honoring the eights. And it's, I had a doctor tell me when I worked myself to the point of like 100 hours a day, I mean, it feels like 100 hours a day, 100 hours a week, nonstop. Everybody suffered. My health suffered tremendously. And my doctor said, you have to honor the eights. This is, your body is made for 8 hours of work, 8 hours of leisure, and 8 hours of rest. And you can borrow from that, right? And she's like, you can borrow from that at different times as you need, because that's just the way life is. But if you don't honor your eights, you're going to get sick. That's where disease comes from, she said. And so it was so profound. It's hard to remember, though. So I would say as a community, the way that you can make sure that you're honoring your eights is to remind each other to honor your eights.
Honor your eights.
Yeah. So my co-founder who sent me an email at like 1 o'clock in the morning, she says, I don't want to wake you up. I said, too bad, I'm awake. Let's just remember to honor our eights. Go to bed. I'm going to bed now, I promise. And so just kind of holding each other accountable to being good to ourselves, right?
Yeah. Yeah, I'm not an expert, just a regular person, but I do believe that common problem for women of color is the superwoman syndrome.
Yeah.
And so I think the one thing we all can do to help ourselves, no matter what kind of woman, with children, without children, no matter where you work or don't work, is to ask for help. And so I saw, a mental health documentary. It was focused on Black women, but it applies to all. And it was basically like in our culture, we have this culture of not asking for help because we have a lot of pride, and we don't want people to perceive us as weak, especially in the Black community because of what people say about Black people. but it's killing a lot of women. The stress, the lack of poor quality food available, the fast food because you're so busy working. And so when you think about it as women, everybody asks us for stuff. Kids ask us for stuff. Husbands ask us for stuff. Boyfriends ask us for stuff. Cousins, uncles, parents. So we have to start saying no, I think, to a lot of things first. And then we should ask people for help. So usually mama is who everyone comes to for help, initially for food, for shelter, for this, for that. And so I think the number one thing we should start saying no more if it doesn't serve us well, and two, to ask others for help because people will say yes. I think 95% of the time people will say, and if they can't help you, they will find a way or help point you in a direction towards something, and it'll take the burden off.
Yeah.
It's so interesting. I couldn't agree more with you, Margot. The idea of asking for help, especially as a single mom, has been like a hard thing to wrap my head around. Because for so long, basically since my daughter was 2, I was doing everything by myself. Occasionally, my ex-husband would be responsive to his parenting responsibilities. But for the most part, I would say like 95% of my daughter's life, it's been on me. It's super hard for me, even to ask for help. Like, I'm tired. I need to sleep.
Yep.
And luckily, she's a wonderful human being and older now. She can take care of herself. But it's still tiring to know that like the responsibility is mine.
Yeah.
So I'm gonna take more of that and ask for help in other areas.
Yeah. And the power of no. There's a great book called The Power of No.
The power of no.
Because when you say yes, you take on the burden of that person's question. Like you add another problem to your life. So just be reflective about what you say yes to.
Yep.
Even if it's a lot of good stuff.
Even if it's a lot of good stuff, that's an extra thing to think about.
It's good to say no to the stuff.
It's good to say. Or later.
Yeah, not right now.
Not right now. Yeah.
No, that's such a good point.
I want to be respectful of everyone's time, especially our East Coast folks. I've been enjoying the convo, really love it. So, Alma, do you think we should do some last minute words?
Yeah. Well, I just want to express my gratitude to all of you.
Yeah.
I think, having an opportunity to be able to talk with experts from our community, because I know that becoming a doctor in education, becoming a doctor in the medical field, and becoming an expert with advanced education, MSW. What is it, Cynthia? MSW.
MSW.
Like,
it's a lot of hours.
It's a lot of hours.
A lot of hours.
And emotional drain. That's the other thing.
Right? And then I'm sure you were one as a Latina in your program, as a Black woman in your program. I know, I could just imagine the added responsibility that came with being probably one of 2, one of 4, one of... How many people were in your program, Tanya? How many Latinas were in your program?
We were actually really lucky, and I think it was because it's USC's urban education, and so they really put an effort. And there's a lot of us that are interested, so I was really surprised by how many there were like me.
So we
were lucky, yeah.
How about you, Ivana? How many Black women in your program? Oh,
you're muted.
Okay, I got her.
In my residency program, where I did my training after medical school, there's a fair number of our trainees. There was probably at one point, I think there were 4 of us out of 24 in our training program, but there were no Black women faculty members at our academic institution. There were community faculty members, but there weren't any in our home, which was interesting. And then once I left that environment, I did fellowship training for 2 years in Salt Lake City, Utah, where I was the only Black female. I think I was the only Black faculty member while I was there.
Yeah. Yeah. So one of a few. What about you, Cynthia, when you were in your master's program?
Yeah.
I think it's I was a handful. I think the rate is like 4 to 5%.
Wow.
Latinos. I had one Latino professor, the only.
And this is social work.
professor of
Yeah.
color.
And in social work.
Yeah. Where is this on the East Coast? New York? Cynthia?
Yeah, I went to Columbia. So
That's like no excuse. Yeah.
That's not an excuse.
yeah.
There'd be so many more.
Rationalize it. There's no
And I'm glad that we all shared that, because part of it is saying, like, when you're one of a handful, there's a lot of responsibility that comes with that on top of the workload, right?
on top of the workload.
The invisible, there's a term, right, that people use, the black tax, the brown tax, of the extra tax that you carry wherever you show up, especially as professionals. So I'm really grateful that we had this opportunity to talk about this, and I think we're going to be looking to you again to have other conversations about how do we help ourselves and help our community and help our families, because as the women, we are the light keepers, and we are the light keepers in so many ways. Even if we don't have children of our own, but we're the ones that are carrying
the community.
The community, we really are. So I just wanted to express my gratitude to all of you.
Yes. And I'm so happy for y'all agreeing to do this on a Friday night.
Yes.
We can go out anywhere.
As well.
I was like, this is when the sister girl Comadre circle is real. Who's going to come out on a Friday night?
So props to all of you, especially you, Cynthia, in New York. So it's been, since we did this 2 weeks ago, a lot has happened another 2 weeks in the country. Happy with the DACA decision. I hope some more to make sure it's all 100% good. But happy that good news came out this week. Happy Juneteenth is today, and lots of companies are celebrating this day off.
Yeah.
Hopefully we'll get this day off in the future for all.
I was going to say a federal government holiday would be amazing.
It would be great.
Yes.
Now.
I saw this morning that several of the African American senators, including Senator Cory Booker and Kamala Harris, are putting forward legislation to make Juneteenth a federal holiday.
Awesome.
So let's keep our fingers crossed for that. Did you all hear that?
Yeah, I heard that.
Yeah.
Wow.
That's pretty cool. Yeah, I mean, in news that's not so great, at 12:30 our time in the morning, the Tennessee legislature pushed through a 6-week abortion ban. So we didn't do that.
Wow.
At the very they had the legislation was on the schedule to be discussed earlier in the year, like in January, but then COVID.
Right.
And so they're like, oh, we're not going to talk about that this session. And then they snuck it in without under the emergency rule, like Rule 30. So,
Wow.
Yeah.
So we have to stay on top of.
We got to stay on top. We have to stay on top.
Yeah.
Another discussion should be about voting and policy of what's
Absolutely.
to our country very soon. So we're paying attention to everything, because I was nervous about the DACA ruling because of the protests.
Me too.
Had kind of slipped it under the radar. I was so worried that a negative outcome would come because we weren't all actively paying attention to it. But happy that something positive came through.
Yeah.
So we need to pay attention.
Yep, absolutely.
Yeah.
That's right.
All right, ladies. Thank you so much.
Thank you for having me.
I've learned a lot.
It's such a pleasure to meet you all.
Yes.
It was really, really a lovely conversation.
Yes, thank you so
Thank
much.
you so much. Yeah, thank you for the invitation. It's great to be here on a Friday night, even if we weren't in a pandemic.
Yes.
Still love to share space
Awesome.
and time with you all, and definitely a lot of other topics to be
Oh,
have a conversation about.
Mhm.
For sure. So we'll do it again. We'll plan another one so that we can bring your expertise, your wisdom, your love forward.
Yeah.
And we move forward with our game plan to get Latinas and Black women together, united on stuff that matters for our communities so that we can advocate for ourselves and advocate for each other.
Yes,
For sure.
All
Yeah,
right.
Definitely.
Yes. Thank you
Wonderful.
all. Good night. Bless your families.
Yes.
Have a great weekend.
Okay, bye everyone.
Bye.
see ya.